Hi, my name is Melea with Urgent Care 24/7. Today we're going to be discussing incentive spirometry. This is a funny looking thing that you may be given in the hospital after you've had a surgery. And you may be confused about what to do with it, so today I'm going to be explaining to you what it is. So an incentive spirometer is a tool used to help keep the lungs expanded. It makes sure that you're using deep breaths after you've had surgery that may make that uncomfortable, such as a heart surgery or a stomach surgery if you've had like a C-section or something like that, to where taking a deep breath may be very uncomfortable. So when you've had a C-section or another surgery around the thoracic area, around your lungs, it can make it difficult to take those deep breaths in because of the pain. And while holding that area may make it a little bit better, it still isn't expanding your lungs to where they need to be. That's where an incentive spirometer comes in. An incentive spirometer helps visually show you how much air you're taking into your lungs, which really helps ensure that you're taking those deep breaths in. So by taking deep breaths, it ensures that your lungs are staying healthy. There's little things inside your lungs called the alveoli that are like little tiny balloons that make sure that the oxygen gets into your blood when you take a deep breath in. So if your lungs aren't expanding, then your alveoli aren't getting that oxygen that you need. So by using an incentive spirometer, it's making sure that you're still getting those deep breaths. And that lets us know with the different numbers how much you're actually getting in. If you're pulling 500, then we may be a little concerned. But if you're pulling 2,000, we may say that that's a pretty good thing to do after surgery. So let's take a look at what an incentive spirometer looks like. So this is an incentive spirometer. This is what you may be given after surgery. It looks kind of funny. It has this long tube with a mouthpiece and then this tall little entrainment center where it has different volumes that you may see. So what you're going to do to use an incentive spirometer is wrap your lips tightly around the mouthpiece right here, and you're going to take a slow deep breath in. And you can see if you're taking a good slow deep breath in by looking over here where it says best, better, and good. You want to keep it in the middle around better or best. If it's good, that's still okay. But you want to make sure you're taking a slow deep breath in so that you get an accurate measurement. So for your accurate goal, you need to look at your age and your height. And typically your respiratory therapist or your nurse will set that for you. And it will be indicated by this yellow dial right here. So all you have to do while you're in the hospital or recovering at home is wrap your lips tightly around the mouthpiece and take a slow deep breath in while sitting up. That lets you get an accurate measurement of how much volume you're inhaling into your lungs. The higher your number, the better you are. And just keep practicing with it. If your numbers are low, the more you practice, the better you'll get. So while you're in the hospital, you're going to want to use it as much as your doctor, nurse, or respiratory therapist advises you to use it. Typically, this is about 10 times every hour you're in the hospital while you're awake. If you're asleep, get your rest. Don't worry about waking up in the middle of the night to practice. But if you are awake or you're watching TV or laying in the bed, just pick it up and practice with it as often as you can. Just take those slow deep breaths and make sure you're doing a good job while taking those breaths so that it really is helping your lungs. So when you're in the hospital or at home recovering and practicing with your incentive spirometer, make sure you're sitting up straight in the bed, holding your incentive spirometer, wrapping your lips tightly around the mouthpiece, and taking slow deep breaths deep into your lungs, and then holding it for about 3 to 5 seconds and then releasing. That's going to really help open up all those little chambers in your lungs and making sure that you're getting the best oxygenation possible in your lungs, as well as preventing other issues such as pneumonia or atelectasis. So just keep practicing and I know you'll do great. Thank you so much for this chat today about incentive spirometry. I'm Melea Williams with Urgent Care 24/7. Life is 24/7, and so are we.